Hello, everybody. I'm Dr. Zach, CEO and founder of Expert Breast Imaging in Savannah, Georgia. Thank you, everyone, for tuning in to this week's Expert Breast Imaging Facebook Live. So, tonight's topic is if you have breast implants, whether they're silicone or saline, can it hide or obscure a breast cancer on your mammogram? And the short answer to that is yes, it can. So you should be aware that when we do a mammogram, we shoot x-rays that travel in a straight line. So if your saline or silicone implant is in line with the x-ray and that x-ray also goes through breast tissue, then we may not be able to see the cancer. It may be obscured or hidden by the breast implant. Now, we always do two views, and in patients with implants, we actually do extra views where we try to push the implants out of the field of view. And so recent research has shown that anywhere from 9 to 44% of the breast tissue where the breast glands are and where breast cancers arise can be obscured by breast implants. And there are multiple factors that we're going to go over. So we're going to go individually through each one of these, but just to give you a quick overview, they are the type of implant, where the implant is placed in the breast, the age of the implant, whether there's any fibrosis or implant-related scarring with the implant, and then the relative size of the breast implant itself, and that's compared to the amount of breast tissue that each patient has. So first off, the type of the breast implant. So silicone implants are really dense, and when things are dense on an x-ray, they absorb all of the x-ray, and so everything shows up as white. So with saline, a little bit more penetration of the x-ray does take place, and we can actually use our digital settings on our reading stations to kind of window it so that we can see some breast tissue through a saline implant, but we cannot window a silicone implant. So if you have a saline implant, it's a little bit easier to see more tissue. So where the implant is placed. So the two most common locations that implants are placed in the breast is behind the glandular tissue and in front of the pectoralis muscle. And the other common location is to place the implant behind the pectoralis muscle. And the ones that are placed behind the pectoralis muscle, we can typically push those implants out of the way and get more breast tissue. So we can see more breast tissue if you have the subpectoral location rather than the subglandular implant location. The age of the implant. So we all know that the risk of rupture for breast implants increases with age. And just like increasing age also can limit the amount of breast tissue that we can see on your mammogram, because the longer that an implant has been in situ or in place, the more likelihood there is that there is fibrosis and implant-related scarring, which is normal, and there is different severities of this. Some women have very little scarring, other women have pronounced scarring where the implant is not able to be moved at all. And so when we do implant displaced views on mammography, we try to push the implants out, and if we're unable to even move the implant even a smidge, then we are a lot more limited in the amount of breast tissue that we can see. Now, obviously, if the implant is mobile and we can move it freely, then we can push the implant completely out of the way, and very little breast tissue will be missed on the mammogram. And then lastly, the size of the implant to the size of the breast itself. So the smaller the implant is compared to a larger breast would mean that we can see more tissue. Whereas if the implant makes up most of the breast and there's very little breast tissue, then that mammogram would be limited and we would miss breast tissue and possibly miss a breast cancer. So as you can see, there are many factors that determine how much effect breast implants can have on cancer detection. The most recent research, which was using 3D or digital breast tomosynthesis with implant patients, said that there was a decreased cancer detection rate of 22%. So women who have breast implants we could be missing about 22% of the cancers if they're there. So that's a very significant number. That's right up there on par with women with dense breast tissue. And we all know that we inform women with dense breast tissue that their mammograms are limited. So I would like to see, whether it's in the radiology reports or where the radiologist is talking to the patient, that they inform the patients that if you have breast implants, that your mammogram could be limited. Now, there is one caveat that, there are women that I do not think we're missing any breast tissue. If they have a mobile implant that's small relative to their breast size and it's relatively new and it's saline, we can displace that and not miss any breast tissue. So I don't think this is a blanket statement that can just be put in a report. And then there's other women who have maybe an older implant that's subglandular in location, that's silicone, and it does not move in its rock, and the woman has a very small breast relative to the implant size. Then yeah, we could be missing a lot of breast tissue, and I think it would be the radiologist's job to inform the woman that mammography may not be as accurate, and that a cancer could be missed, and to consider doing supplemental exams. But if you never get to speak to your radiologist, if your radiologist never shows you your images, which that's what we do at Expert Breast Imaging, myself or another fellowship trained breast imager will always go over your results, show you your images, and tell you whether they think supplemental imaging is necessary for you or not. That's very rare. I know you don't get that anywhere else in Savannah. I would hesitate to say, but I probably don't get that anywhere in Georgia and very few locations around the United States. But I do believe that's the best care that you can receive. So if, little selfless plug here, if you want to get your results from a radiologist, if you want to see your images, if you want to get personalized recommendations, then tell your friends and family about Expert Breast Imaging. We do not have a wait. I know one of the sites around town recently got quote unquote attacked with cybersecurity. I don't know whether that's the true issue or not. They did cancel a bunch of diagnostic exams and screening mammograms. So if you're having trouble getting in, do not delay. Breast cancer does not wait. You can call. We can get you in this week. We can get you in tomorrow. July 4th, we are closed, but we can get you in as soon as possible so that you don't delay a possible diagnosis. So next week, we're going to continue with the breast implant topics. We're going to go over whether breast implants increase your risk for breast cancer. So tune in next week at 5 p.m. I'm Dr. Zach. I hope everyone has a safe holiday week. Happy 4th, everybody out there. I hope everyone stays safe and cool, and we'll see you next week.